Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to The Valley Today. I am your host, Janet Michael. Happy Thursday as you are listening to the show today. It is the third Thursday of the month. That means we are talking about your health. This is part of our community health partnership with Valley Health, where we speak with doctors and administrators every single month. And today on the Zoom screen, I have Dr. Troy Glembot. He is the medical director of the Valley Health Metabolic and Bariatric program. Dr. Glembot, thank you so much for taking some time to have a conversation with me today.
Well, thank you so much. I'm excited about this interview.
So I know that a lot of what we're going to talk about is metabolic and bariatric surgery, but before we get into the weeds on the procedures, talk to me in general about obesity, because it is a huge issue in our country.
Yeah, it's become a worldwide epidemic that transcends a variety of countries across a variety of socioeconomic classes. It really is a disease that has exploded really over the past 30 or 40 years. How that happened is complex. I'll be honest with you. There are a variety of reasons why people may suffer from accelerated weight gain. Some of the reasons are genetic. Although our genetic makeup hasn't changed a lot in the past 30 or 40 years, we may well have genes in our system that predisposed us to developing this problem when placed in the right environment. And that environment really includes a lot of the foods we eat. It's interesting when you think about it. Never before has there been more fat-free and sugar-free options in our diet, yet we struggle with this thing called obesity. The other part that's really strange is we've never seen so many gyms available, and yet we struggle with this thing called obesity. So it really is a very complex problem that really does affect the entire world, not just the United States.
And I think so much of it is, and you touched on this a second ago, is lifestyle, because we're working more, we're not at home. When I look at pictures, old family albums of my grandparents and my great-grandparents, they worked, mom stayed at home, the meals were nutritious, there wasn't a lot of snacks, there were no McDonald's drive-throughs on the way to soccer practice. A lot of that does have an impact in how we end up eating on a daily basis.
And you bring up a great point, and that is the fast food part. So you can predict childhood obesity based upon where the child's school is in relation to the nearest fast food restaurant. And the reason why this is important is because one of the biggest risk factors for becoming obese as an adult is being obese as a child. So when all of a sudden you're priming our young people, our adults of tomorrow, you're priming them. We've been doing this now really for over 30 or 40 years. Proximity to fast food, access to it. You have childhood obesity really taking off, and that translates into a higher likelihood of adult obesity.
And when you're talking about obesity, I know that there are weight ranges for obesity. There's overweight, and then there's obese, there's morbidly obese. What are those different designations?
So all of that is based upon a number called body mass index, or BMI, and it's a way we can compare a person's weight to their height. And a person's considered to have a healthy body mass index if it's between 18.5 and 24.9. A person's considered overweight if the body mass index is 25 to 29.9, and obese if the body mass index is 30 or more. The other interesting thing is that it isn't just about obesity, it really is about extra weight. And a lot of diseases can emerge when a person isn't necessarily obese. There's a lot of diseases and conditions that are made worse by extra weight. That doesn't necessarily mean that you have to have a body mass index of 40 or 50. Having a body mass index in the high 20s can predispose some people, for example, to diabetes, which is a big deal.
And diabetes is one of those issues where if you get your weight in check, sometimes it can, and I don't want to say go away, but it is a whole lot more manageable if you eliminate that risk factor.
Yeah, you're exactly right. Type 2 diabetes is a particular problem among many people as we grow older. It's funny, there's a lot of different ways you can look at obesity. And one of them is that it tends to accelerate the aging process. And what do I mean by that? So for many adults, if we live long enough, we will eventually develop type 2 diabetes or high blood pressure, cholesterol, or arthritis in the knee. And these are things that happen in people as they turn in their 60s and 70s. The thing with the extra weight is that those conditions, the diabetes, the high blood pressure, cholesterol problems, arthritis in the knees, instead of happening in your 60s and 70s, these are occurring in people in their 20s and 30s and 40s because of the extra weight. So you can think of the disease of obesity as just being tied to a number, but rather as a condition that accelerates the aging process.
So metabolic and bariatric surgery, that sounds like a scary thing. But what exactly does that involve? And should just anybody get that? Is that your first option, or are there other things?
No. So I guess the first question is, why are you making me call it metabolic and bariatric surgery instead of just bariatric surgery? And that's a fair question. The reason is because, and I kind of alluded to this a minute ago, a lot of people have accelerated disease conditions that occur before a person becomes technically obese. So for example, if a person has a body mass index in the high 20s, 27 or 28, where they're still technically considered in this arbitrary range as being overweight, they can still have a terrible bad problem with type 2 diabetes, which may well go away or become much easier to control at a healthier weight. And those individuals may well benefit from metabolic and bariatric surgery. And that's where you're like, wait a minute, stop the presses. You're going to do bariatric surgery on somebody who's not even obese? And the answer is, well, yeah, actually, sometimes you can. The whole concept of metabolic surgery kind of came about back in the late 1960s, when we're kind of operating on normal organs to address some other disease condition. And one of the big things that kind of came out of that was this whole idea of cholesterol problems, and another one was diabetes. And those are two big things where we're trying to operate on a normal gastrointestinal tract to affect these other metabolic conditions, for example, like cholesterol problems or diabetes. So the concept of metabolic and bariatric surgery was really embraced by our society about 10 or 12 years ago, when they even changed the name of our society from the American Bariatric Society to the American Metabolic and Bariatric Society.
And I think it goes a long way to explaining to people that these things are related. I think sometimes you just think, you hear obese, you think, oh, they eat too much and don't exercise enough, when there is a whole metabolic issue to it, and they all are related to everything else in your body.
It's funny. And another way to think about this too is, a lot of times people ask me if I watch this TV show called My 600-Pound Life. And, at the end of the day, there are so many people who could very easily tell a story about their unhealth with My 250-Pound Life. And the point is that it goes back to this whole thing, the extra weight and what it does to your body isn't just based upon what BMI range you have, but a lot of people have a substantial disease burden that is accelerated or made much worse, and it might not be at such a heavy weight that you think. It might not be a 600-pound issue. It could, for many people, be a 250-pound issue.
Well, and a lot of times the weight that you're carrying sometimes is a mental weight as well. That takes a toll on you in a lot of ways too.
Yeah, absolutely. I mean, the suffering that the extra weight causes isn't just the physical and emotional, but it's just hard. It's hard to live, right? It's hard to do a lot of things. And as you and I both know, there's a lot of parts to our body and our life that don't get easier as you get older. I'm reminded of that every day I get out of bed.
I wasn't quite as aware of it until I got 2 puppies a couple of months ago and realized, wow, picking these puppies up and carrying them around. And I joked on a radio show a couple of weeks ago that my Fitbit must have thought it was stolen the first few weeks that we had these dogs, because I got more steps than I had ever gotten in the 3 years that I had owned it. But we wear out a lot quicker than I think we think we do.
Yeah. And our wearing out happens faster with the extra weight. That's the important drive home message.
Well, let's take a quick commercial break. When we come back, can we talk about what some of these procedures are that you offer through the bariatric program at Valley Health?
Certainly.
Okay, we're going to take a quick break. When we come back, we're going to continue our conversation with Dr. Troy Glembot. He is the medical director of the Valley Health Metabolic and Bariatric program. We're going to continue our conversation in just a couple of minutes, so hang in there.
Got a financial decision to make or a goal to reach, but you don't know where to start? You've come to the right place. Introducing Quick Money Chats with the Northern Shenandoah Valley Financial Education Program. Visit tinyurl.com/quickmoneychat to schedule a virtual chat with a staff member or trained volunteer. We won't tell you what to do, but we will give you the tools you need to choose wisely. And because Virginia Cooperative Extension is part of Virginia Tech and Virginia State, your land-grant universities, you can be sure that our information is credible and trustworthy. And you'll know that we aren't trying to sell you something. Maybe you want to improve your credit score, or reduce your banking overdraft fees, or even figure out if you can afford to buy that car. Sorting through tons of information on the internet can be overwhelming, and sometimes it can be hard to know who to trust. Schedule a Quick Money Chat and get the information you need to take action. Go to tinyurl.com/quickmoneychat and get financial education personalized for you.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Thursday as you are listening to the show today. It is our Community Health Partnership Day, in partnership, of course, with Valley Health. We are on the Zoom screen with Dr. Troy Glembot. He is the medical director of the Valley Health Metabolic and Bariatric program. And Dr. Glembot, in the first segment, we talked a lot about obesity, what it is, what it means to people. I joked with you during our break about how do I find out my own BMI, or is that something I have to go to the doctor to do? And you said I could Google BMI calculator, and I warned you I was not doing that on the show. But if somebody does do that, and it's that number that finally makes them realize, wow, I really need to see a doctor about this, what is their first step? What process do they go through if they pick up the phone and call you?
Well, there's a variety of first steps. People, at the end of the day, people have their own path to realize how they want to address their health issues, and weight is no different. And really what it boils down to is having some sort of plan, or having an idea about what you want to do. And if it works, great. Certainly when you start to become concerned about your weight, is the first step running for an operation? Well, no, you may want to start trying to do your lifestyle things. You might want to try to change your diet. You may want to try doing all those things that we all know and are familiar with about how to lose weight. But here's the thing. If it is not successful, then you could, for example, talk to your primary care provider or one of your physicians. You could certainly call our office and we could talk to you about different options. You know, this disease is very difficult to treat, and you really want to take a scaled approach. So think of it as, I'm going to try this, but if it doesn't work, don't keep doing it. Do something else, right? If the something else goes from diet and joining a gym and it doesn't work, talk to your main medical doctor or call our office. We have medical treatment options in our office, which may involve seeing a dietitian. It may involve taking some weight loss medications. And if it works, great. But if it doesn't work, don't keep doing the same thing. You do the next step, which might be, for example, some endoscopic therapies for some people. So there are some types of procedures where we might be able to use an endoscope through the mouth to place a balloon inside the stomach for some people, which will help aid in weight loss. If that doesn't work, then you start talking about different types of surgical procedures. That's what I do. We do the endoscopic therapies, and I also do the other laparoscopic surgeries. Together with my partners, Dr. Chris Reed and Dr. Salam Sadi, we offer a comprehensive suite of minimally invasive procedures that we're now doing mostly on a robotic platform with the small incisions. So the most commonly performed operation done in America today to help people get to a healthier weight is something called a sleeve gastrectomy. The sleeve gastrectomy was originally developed to be a safer alternative to the gastric bypass. There's a couple things to know about the sleeve. Number one, it does involve permanently removing 90% of your stomach. Gone. Cannot be put back. Now, the thing to know about this is that while it does provide weight loss, the weight loss is not as good as what's seen with the bypass, for example, and 3 out of 4 people can have heartburn that's made worse by this procedure. So 3 out of 4 people have heartburn and get worse. The next procedure that's available is the gastric bypass. This procedure has been around for over 50 years. A lot of people don't realize that. You know, bariatric surgery has been around for a long time, since the 1950s. But the gastric bypass has been around for over 50 years. This operation has a better weight loss profile than the sleeve, and it also has a higher likelihood of treating diabetes in the sleeve. A lot of people don't realize that either. And then the last set of options are what we call duodenal switch procedures. These procedures, there's 2 versions of the procedure. The original version of the procedure was developed back in 1991, but these are the procedures that have the highest likelihood of the most amount of weight loss, but also have the highest likelihood of complications, okay? But if someone sort of says, you know, I've struggled with my weight all my life, my body mass index is over 50, I'm done with it, I need to do whatever it takes. You know, the duodenal switch procedures are the ones that do have the highest likelihood of the most amount of weight loss. There's a newer version of that procedure called a SADI, and it is a procedure that was just approved in the United States this past spring. That's another type of procedure that we offer as well. So the point is that there's a lot of different types of interventions that start where we all know where they start, right? Diet, lifestyle. They then go to medications. They then go to some endoscopic therapies, and then they go to the more advanced minimally invasive surgical procedures, all of which we're able to do here at Winchester Medical Center through our program.
And it's important to note, too, that if you go with one of the surgical procedures, that's not the end of your weight loss journey. There are certain things that you have to do, certain lifestyle changes and dietary changes that you have to make in order to be successful long term.
You know, and that's where our program really stands out, because we have that, right? We have full-time dietitians, we have full-time behavioral health therapists, we have specially trained advanced practice clinicians with our 2 nurse practitioners, Rick and Amanda, who do a spectacular job, as well as as well as the surgeons, and all of us being under one roof. I mean, that matters, right? Because we're all functioning in a coordinated way to provide the safest, best care possible for our patients.
And how much of this is typically covered by insurance? Does it depend on how much of an impact it's having on your actual health on whether or not insurance will cover any of it?
Yeah, so statistically, about 80% of people who inquire about our program, about 80% of people do have an insurance benefit for metabolic and bariatric surgery. The benefits change based upon the type of insurance you have. And it can be a confusing landscape. If you have any question at all about it, by all means, you could talk to our navigators in our office, whose full-time job is to sort out each individual's insurance. You and I might both have Blue Cross Blue Shield insurance, but that doesn't mean that's the same type of coverage. So, for example, it is a complicated landscape, and sometimes getting to the answer that's the correct answer for you is something that our navigators have to help you figure out.
And the whole thing seems like, on one hand, it seems like, wow, this is a pretty complicated process. But on the other hand, it's a process. It seems like it would be a little bit more, make me feel a little bit better about it, because I know this is step 1, step 2, step 3, and you've got people there all along the way to walk me through it.
Yeah, you bring up a point. It is complicated, and for many patients who come inquiring about this specialized care, we're going to assume you've not done this before, but we have. So, and that's why we really do want to more or less kind of take you by the hand and bring you through all the steps that need to happen. We're not just going to throw some stack of papers at you and tell you to fill these out. We're going to help make up. For example, when you come in to see for your initial consult, you're going to be assigned a navigator, and they're going to be the ones that's going to help you set up all your appointments and follow-ups and blood tests and everything like that. We're not going to expect you to know how to go out and do all those things.
Well, that's comforting because we have to go. My husband's health insurance has a wellness plan, and we get a discount if we participate in this wellness plan, but it requires having to go get blood work done and all that sort of stuff. And I'm always the one that's doing it the day before. It's too late to get it done. So that sounds to me like heaven, that somebody is going to navigate that whole thing for me.
Yeah.
Now, when I was doing a little bit of research, I won't call it stalking because they've asked me not to do that anymore. But when I was doing a little bit of research on Valley Health, if you go to valleyhealthlink.com/bariatric program, there was something on there about some online information sessions. Yeah. Are those a good place for people to start to just kind of figure out what's what?
Absolutely. I mean, we used to just do these information sessions twice a week. So you had to, drive down here to Winchester, you had to find the class, park your car, all that sort of stuff. And really about 7 years ago, we started to migrate to the online platform. And quickly, we now have most people do this information session online. There are a couple of big advantages. Number one, you don't have to drive anywhere. You can wear whatever you want to wear. You can do it whatever time of day or night you want to do it. And, that's that. And at the end of it, you would fill out a form online, and we would get the information, and my office will reach back out to you. And that may be where you want to answer some basic questions about, hey, does my insurance cover this? So, and then from there, we will pick up the ball and make an appointment to be seen by myself or one of my partners, Dr. Reed or Dr. Sadi. Now, and we also have telehealth capability. There's a lot of reasons why people may or may not be able to travel, and we have telehealth capability. So, there's a variety of reasons. There's a variety of ways in which we can accomplish getting this started.
It sounds like a really great low barrier way. If you're still thinking, I know I need to do something, but if that but is still a little too loud in your mind, this is a great low barrier way to just see what you're letting yourself in for.
You bring up a great point. A lot of people who struggle with their weight have struggled with barriers for a lot of their life, physical, emotional, transportation. I mean, there are a variety of barriers that can seem insurmountable. But we try to develop our program around such a way where we can identify those barriers and try to at least lower the height on them. Try to help people be able to get through those and get the care they need.
If they can't jump over them, at least they can crawl over them.
Yeah. Or we dig a hole through the barrier that way, walk around it. Yeah.
They can have a tunnel, all sorts of different options.
All sorts of options. Exactly.
Well, Dr. Glembot, thank you so much for taking some time and explaining all this to me. It's one of those things where I always thought I knew what it was, but you never know if what you know is really true. And you've really answered a lot of questions for me today. I appreciate it.
Well, great. Well, thank you so much, Jan. I really appreciate it.
We are going to wrap up our conversation today with Dr. Troy Glembot. He is the medical director of Valley Health Metabolic and Bariatric Program. I mentioned a minute ago, valleyhealthlink.com/bariatric program. I'll put that link in the show notes page so that you can go there and click through to see all the information that we've been talking about today. I will meet you back here tomorrow. It is United Way Day. So Elise will be on the Zoom screen with me along with Andy Gale from Literacy Volunteers Winchester area. So meet me back here tomorrow, just a few minutes after noon.